Good afternoon. I'm going to present the following study titled Design and Preliminary Validation of a Simpler Version of the Bladder Diary for the Evaluation of Lower Urinary Tract Symptoms. My name is Santos Pérez de la Blanca. I am 5th year resident at University Hospital 12 de Octubre in Madrid. I have no affiliations to disclosure and I have been sponsored by Wellspect. 3-day volume chart and bladder diaries constitute a valuable diagnostic tool in evaluating patients with LUTS. They provide objective information on voiding habits and fluid intake. However, they usually require a significant effort for patients to complete, especially concerning the duration and the requirement of urine collection for the void volume measurements. The aims of our study were to design a simpler version of the voiding diaries and to assess its cognitive validation in healthy volunteers in comparison with 3-day voiding diaries. For this, we designed a simple voiding record including 6 items, which must be filled for each urination during 48 consecutive hours. These items included day or night void, scarce or abundant, presence of voiding difficulty, urgency or incontinence, and number of pads. Healthy volunteers older than 18 were recruited to complete both a version of the voiding diary and the new voiding record for 2 consecutive days each. Voiding parameters were compared between both records. This included the number of total voids, day voids, night voids, and number of incontinence episodes. Urgency was compared by measuring the urgency yes in the new voiding record and the urgency grade 3-4 in a scale of 1 to 4 in the voiding diary. Total voided volumes were measured in milliliters in the volume chart and compared with the scarce and abundant item in the new voiding record. We set off cutoff points at 150 milliliters and 400 milliliters. Moreover, we analyzed volumes according to the number of day voids, setting the cutoff point at 10. Total of 20 healthy volunteers completed both registers for a period of 48 consecutive hours each. This included 10 women and 10 men of a mean age of 42.5 years, in a range of 27 to 69. As we observe in the table, there were no significant difference between both registers concerning the number of total voids, day voids, and night voids. There were no incontinence episodes recorded. Urgency yes in the voiding record was comparable to urgency grade 3-4 in the voiding diaries. As we can observe, there were no significant differences. Moreover, concerning the scarce or less than 150 milliliters, they were also comparable between both registers. However, we observed significant difference between abundant voids and more than 400 milliliter voids between both registers. We observed no significant difference in mean voided volume in patients with 10 or more day voids compared to patients with less than 10 day voids. However, we observed significant differences when comparing the number of scarce or less than 150 milliliters among the both groups. With this, we can say that a simple voiding record will allow the determination of daytime and nighttime voiding frequencies, urgency and incontinence episodes, and in addition will allow the assessment of voiding difficulty. However, regarding voiding volumes, despite avoiding urine collection, an adequate correlation for voids considered scarce or less than 150 milliliters was observed. However, further study is required to detect a more accurate threshold for the abundant voids. Finally, patients with higher day voiding frequency of 10 or more were found to have significant reduced void volumes. To conclude, we can say that the design of a new voiding record of easier completion may be more practical and increase the compliance rates, also being helpful in the evaluation of patients with LUTS as an alternative to bladder diary and volume charts. Preliminary results show adequate correlation with bladder diary for most of the parameters, and it could help obtain a better fulfillment rate to select patients who require referral to functional urology units. Thank you very much.